conversation over an attempt by, at that time in 1862, the French Empire to try to annex Mexico to France due to some, I guess, challenges they were having with some debt. That at that time, the country was going through a lot. Mexico was going through a lot. And it had to default on its debts with Spain, England, and France. And England and France, I'm sorry, England and Spain actually were gracious enough to forfeit or basically forgive the debt to Mexico. But France actually at that time, under the rule of Napoleon III, took the opportunity to attempt to annex Mexico as part of its country, kind of like in repayment for the debt. So Cinco de Mayo commemorates basically a big battle that took place at the town of Puebla. And it's basically very emblematic because the president of Mexico at the time was Benito Juarez, who was of indigenous, he was a Zapoteca indigenous leader who basically became the president of Mexico at the time. And he was the leader at the time who was basically engaged in, I guess, preventing the French troops to take over Mexico. So in the 1960s in the United States, the reason that the holiday has taken so much footing in the United States is that in the 1960s, the Chicano movement rightly took, pride and drew from the history of this event as kind of like symbol of both Mexican identity, independence, and also like indigenous power, right, in Mexico. And so it became kind of like a battle cry for the Chicano movement. And that's kind of how we know in the United States how Cinco de Mayo is celebrated. And so for those who didn't know, right, a lot of people confuse Cinco de Mayo with Independence Day. Independence Day in Mexico is the 16th of September. It's not Cinco de Mayo. Cinco de Mayo is just a very important date in the history of the Mexican nation. So right now, everywhere, right, is spring. So to commemorate Cinco de Mayo, I am actually bringing a spring song from both Cuba and Central America, and this song is called El Día Feliz, which is kind of like the Cuban version of Oh Happy Day, right? Like, but this is the very stylized and clearly different take on that song, and it basically celebrates spring. Se está arrimando un día feliz, como hace un barco tras los meses. Se está acercando un día de abril, un día de abril se va a arrimar a los finales de noviembre. Y yo me apego más al mar. Mi hermano doble de los peces, le enciendo leña en el hogar que vio brillar la tempestad y unía el curso de estos meses. Se está acercando un día de abril, un día de duendes en añejo. Se cerca un pájaro veloz, zumbando al roce de tu olor, se acerca un tiempo de conejo, y a mí me escarba la ansiedad. Me escarba hondo acá en lo blando. Escarba simple de escarbar como para que se hunda más el día feliz que está llegando. So the guitar and the voice attempts to replicate what a bird does as it hops from branch to branch. Thank you. Thank you for listening.
Ario, that was incredible. Thank you. I think you can all see that why we are so touched by all of these collaborations, and it's people like Ario and all of you that each bring such unique talents, and we hope you're finding that you can bring all of yourself to the collaborations that we partner on. So Barb, with that, I'll hand it off to you.
Great. Thank you, Rachel. First of all, my name is Barb Lupo, and I have the privilege of being the chair of the Community Collaboration Committee for Peace Health, and I represent the Community Health Board. And I really want to thank all of you for participating with us today. And I want to share a little bit about the legacy that has been given to Peace Health leadership and to our community from the Sisters of St. Joseph of Peace. For those of you that don't know, it was in 1890 that two Sisters of St. Joseph of Peace came to Wacom County to serve the loggers with their medical needs. And as they grew and expanded their responsibility, so grew Peace Health. Now, 131 years later, we remain the primary medical center for Wacom County. And one of the things that the sisters still give us today, but have left us with as gatekeepers, are our core values: respect, social justice, stewardship, and collaboration. And collaboration really is kind of what I want to talk to you a little bit about today. Our core values, those of the legacy of the sisters, have guided us, particularly the Community Collaboration Committee, in our work. About 5 years ago, our former board of directors, now our Community Health Board, began the conversation concerning our role as collaborative partners in the health of our community. For years, we had been funders, and it really wasn't enough. We really began as a group to engage in our own conversations about how can we be part of our community outside of our hospital walls? How can we educate and listen and partner with all the work that's being done to solve some of our community issues, understand our community issues better, and really become an integral part of what community health looks like. Like I said, we began our journey as funders, and we really wanted to be at the table of the conversation of community health. So we left behind our community benefit committee, which was met once a year and really just kind of, like I say, was funders. And we gathered community partners to meet with us once a month and really kind of started an educational process. We now have Unity Care, Opportunity Council, the school district, community physicians, and other community volunteers that make up our Community Collaboration Committee. And we have spent the last 5 years really, really trying to get to know all of our community partners, all of the community work that is done around health, around social justice, around collaborative efforts, in an effort to figure out how we can best help all of you. We've spent, like I say, we've spent these last 5 years getting to know all of you, and we're so grateful for that. We want to be more than funders. We really want to be part of the conversation. We're grateful for each of you and all that you have done to let us be part of your conversation, for letting us really educate ourselves. And we are looking forward to cultivating more conversations and really listening and hearing what and how we can assist in our partnerships. So thank you very much.
Thank you, Barb. Barb is very humble. She's been our fearless chair for each year. She re-ups and says, I think I'll do another year. And we are so grateful to her. So thank you, Barb. Really a champion of our community health here locally. As Barb mentioned, the numbers are only one piece. It's for us, it's very much the relationships. Last year, we were truly honored to be invited into partnership with all of you. And we're able to award just over 500,000 in community benefit awards to partnerships that align with our focus areas, which we're going to share in just a moment. And then just on this little slide, I want to include, these are our full complement of our community collaboration committee, as Barb mentioned. And I think most everyone's on the call today and are eager to hear from all of you. We're going to give all of you a chance to, in just a moment, to share a little bit more about what has the collaboration been, what's been most meaningful to you. And we'll use the chat window so that we can capture a bunch of stories. So in the last year, looking back, we have really guided by and driven by our community health needs assessment. These were the 4 focus areas that emerged, not just here in our ministry in Wacom County, but also in our ministry in Skagit County, on San Juan Island, in Ketchikan, and across Peace Health Hospitals on our other locations across the organization. And what we saw was that there is a huge need for us to be involved in work that builds access to service-enriched housing, that creates more affordable housing access in our community. And in particular, we've really chosen to focus on how do we support for those individuals who are medically fragile, but also children and families. So that's how we've really defined our support around the focus of home. Nourished has, if any time, has more prominently showed the need to address food insecurity in our community. The pandemic has certainly shone a light on that. And so we have really grown our partnerships, Common Threads Farms, more recently Bellingham Food Bank, the YMCA, and so many others that are really working to address those basic needs that our local families have around food access. And then care, I'm just delighted to see so many on the call today that are involved in supporting transitions, care transitions in our community. So whether that be an individual leaving the hospital, whether that be a community health worker ensuring that they have their follow-up appointments or their medications when they arrive home, or whatever they need to ensure that those transitions go smoothly. That care focus area is critically important to us. And then the final area, which cannot be ignored, is hope. And this for us is our focus on both mental health promotion and also the prevention of substance use. And I love this little picture shown on this slide. This is actually Linden community last year envisioning what they saw for their community. And the community identified that mental health wellness was their top priority. So on that note, I want to just pause and just celebrate the bounty of collaboration. So what we know is that there are many more interconnections between those 4 focus areas. And we'd love to hear from as many of you that have a chance to share today, just what has been made possible. So through collaboration, whether it's with our partnership or with others, what has been made possible? And we're going to open it up for some stories. I know there's a couple of you on that were had a chance to give this some thought ahead of time, including Allison from Bridget Collins. And I wonder if Allison might not be so shy as to get us started, and then we'll just do hear from others. And if you don't want to share and go off mute, I just would encourage you to jot a little something down in the chat window about your particular collaboration and what has been made possible. Allison?
Okay. So thank you for allowing me to speak today. I am talking to you about the Parents First program from Bridget Collins, and I really appreciate you funding this program. So thank you for that. And I'm just going to read prepared notes so I don't stray. Our vision for this program is that we will engage incarcerated men in reentry services that meet their criminogenic needs, and finally their parenting needs. Mothers and children will be engaged in this process as soon as possible. The reentry needs that will be addressed are the need to continue mental health treatment that is started in jail, or drug and alcohol treatment started in jail, assistance in creating a reentry plan, information and referral, as well as ongoing case management. Criminogenic needs are thinking and behavior patterns that lead to arrest and incarceration. Research shows that it is necessary to address these needs in order to reduce and prevent reincarceration. We trained staff this year in Tyro Dads, which is a program that offers 10 structured group sessions with the intent of reducing reincarceration, and it includes a year of case management. We have not been able to provide this service due to COVID restrictions. We are also providing individual sessions in cognitive behavioral therapy for justice-involved clients. This has been somewhat hampered by COVID restrictions also, since the work is taking place over the phone and into the jail. So these are focused sessions that talk about specific criminogenic needs and how people can rethink them. Referral for parenting services for the original parent and for any other family members is going to just follow the already established process for parenting programs at Bridget Collins. We have chosen to focus mainly on fathers because there are less services available to fathers, and the predominance of people in jail are men. And research shows that men who are involved in actively parenting their children have a reduced rate of reincarceration. Research also shows that children who are deprived of contact with their fathers develop behavior problems and suffer from depression and feelings of low self-worth. Our program will also use child-focused incentives to keep clients engaged in case management. The use of incentives is an evidence-based practice which significantly improves engagement. At present, we have provided case management to 9 people who are no longer in the program. We have 7 people on the caseload and 3 pending. Of this latter group, 3 are African American, 3 are Latinx, 1 is an American Indian, and 2 are white. 1 of the men is currently in an inpatient drug and alcohol program, and 3 are incarcerated. We developed this caseload by monitoring the jail roster and then calling people and asking if they would like to work with us. Most people said no for a variety of reasons. Some aren't fathers, some are going to prison, and some simply weren't interested. We have requested referrals from a variety of agencies, but we have not received any referrals yet. In the future, we look forward to assisting released fathers in the community by continuing CBT and hopefully by offering Tyro Dads in groups. So that's all for now. Thank you for listening.
Thanks for getting us started, Allison. I think this is such a wonderful, and I'll let Barb or others from our committee pop in and share more if they'd like, but this is such a wonderful example of we've had a long collaboration with Bridget Collins. It goes back way into our legacy of Sister Bridget. But when we came to Byron Mannering last year, we said, Byron, bring us something forward that is really reflective of our commitment around justice. And he said, there's this area where a program we really want to expand into supporting parents who have experienced incarceration, and we don't have a funding source. And we said, that's exactly what we're looking for. So Byron, thank you for your work and your leadership, and for bringing to life a service that you didn't have to meet that need in community, but you made it a priority. some of your friends are on here today too, so I know. So I just want to open up. Max just shared from the Bellingham Food Bank. Thank you, Max, about some work, and Jen is sharing. So if you have a chance, read those in the chat window. And then I just want to give others a chance to go off mute and just take a minute or so if there's a particular collaboration you want to highlight or something. It could even be a story. It could be a story from community. I see Lindsay went off mute. Even with the
Yes,
baby, she's going off mute.
I would love to share. I think for us, you know, we do housing, Mercy Housing does housing all over the country. And I think the Bellingham is the best place to have housing. And all of that is because of the community support. And I've always said my take on that is that in Bellingham, it's never a no. It's just figuring out what the yes is. And so I really love looking at everybody on this call and seeing how we all collaborate to serve the folks in our community. One of the most impactful things that happened to us this last year, and Max spoke to this in the chat, is our process of food distribution and our collaboration with food systems. So just to highlight some numbers, in 2019, we served about 53% of our populations in our 3 properties with a little over 1,000 touch points. So that meant a little over 1,000 times we provided food access to our residents, to 53% of them. Last year, we upped that to 95% of our residents in all 3 properties with 9,362 food efforts. So we were almost able to multiply that tenfold, which is outstanding. So I know that in our lunch visit, we were able to show off our new pantry, which was, you know, in part done by funds from Food Lifeline and the Bellingham Food Bank. And so just huge change for our residents in being able to access culturally appropriate, healthy food. So thank you for all that collaboration.
Awesome.
Thank you, Lindsay. Oh, wonderful. Who else would like to share?
I would like
Ario.
to share. Yeah, absolutely. So we are a new partner to Peace Health. We started conversations about becoming, you know, more intentionally together, addressing the issues of specifically Latino, LGBTQ plus students, Native American students, you know, in Northern Bellingham and in Ferndale. And what I can share with you is that I guess one of the biggest impacts, and perhaps to answer the question concretely, right, is what has been possible is to, in the midst of this pandemic, to bring a great deal of both material support to students and families who are struggling, who basically with this pandemic, the disparities and the I guess the challenges that they have been facing have been surfaced even to, you know, to a level that we have not seen before. And so this partnership with Peace Health and the school districts with whom we work, it create this sense, this deep, I guess, atmosphere and sense for students and families that they are not alone. And I think that that is perhaps one of the biggest things that we are most proud of, is that we're bringing communities into schools and making everyone feel that there is not only one, but several champions in the community who are going to be in the corner of that student, of that family, when they most need support. We do have through Peace Health this time around, at each one of our sites in specifically in Whatcom County, we have a basic needs closet. And that is something that we provide for not only for students who are being case managed and have this deep caring connection with our site coordinators, but also it's for everyone, right? Like anyone in the school who wants to access any immediate need, there's always someone there staffing that basically closet, and also providing any other kind of resource, connection, referral, etc. Because clearly we're not the experts on everything, right? So we also know our limitations, and I think that being part of this call, for example, just shows, right, the wide network of not only resources, champions, advocates, etc., that, you know, are present in the lives of a lot of our students who for A, B, or C reasons sometimes do not connect to the resources that are available in their community. And I think a great deal of the work that we do together with Peace Health is actually brokering, right, those resources and making sure that people feel that they are connected and that there's someone who can navigate with them the systems and the different, I guess, silos that exist, and we kind of help bridge, the needs and also that resilience that children and families carry within. Right, we're not saviors. We're not saving anybody. We're mostly in the business of tapping and eliciting that resilience and that self-sufficiency. And that's what's been possible in this year, I guess, is more remarkable because we feel like even more connected to the families and the youth with whom we work.
That's awesome. Thank you, Ario. Who else would like to
I'll,
share?
I'll chime in. I'm Chris Kobdish. I'm with Unity Care Northwest, and we've been collaborating with Peace Health for many, many years. And a few years ago, Unity Care Northwest was developing our 5-year strategic plan. And one of the goals that we had was to develop a medical, behavioral health, and hygiene program for patients or the general population of people experiencing homelessness. About 15% of our patients annually are homeless, and we definitely saw a need for some specialized services. And what we discovered was that there was the Homeless Strategies Work Group, and they got together, and in 2017, they issued, what are the top needs for people experiencing homelessness in Wacom County? And our project, wow, that was one of the needs. The other need that was up there was, there it is, respite care and enter Peace Health. So we started talking to Peace Health and brought in the Opportunity Council about what could we do collaboratively to create a program that would surround people with the supports and the services that they need in one location, thus the way station. And you may have been reading about it this past week in the paper because we just received some significant funding for the capital project from the state capital budget of $4 million, which we're thrilled to receive. And also the collaboration includes Wacom County. This site you're seeing right in front of me is, you may recognize that off of State Street, but this site is will be repurposed for our way station. We will have approximately 19 respite beds, and we will also have shower, laundry, medical and behavioral health services for people, and housing case management and other case management services just to start. So we're thrilled to continue this collaboration. It kind of slowed down over the pandemic, but we kept coming back to the table, and this funding is a shot in the arm. We will be definitely planning and moving forward on this and letting you know as it evolves.
So exciting. Thank you, Chris. And I think one of the things that Chris didn't mention is it's fun. It's fun to collaborate and partner in this way. In 2019, the partners you saw mentioned on that sheet, plus others, CMAR joined us and the Lighthouse Mission. We traveled to 3 states, 3 different sites in the state of Washington to look at other models, including hygiene service models and respite centers. And we came away and said, we can do this in Bellingham. We can do this even better. We can create something that doesn't even exist here. And so I just want to encourage us, even in the limitations that COVID presents, how can we still continue to dream together and to think up these incredible ideas that clearly have are valued by the community. I want to take an opportunity just to especially recognize we have Katie on the phone today from Northwest Regional Council, and Grace Thorner, who has just changed jobs but has been a long time community connector here embedded in the hospital. And we have Eric and Natalie from Cascade Medical Advantage. I might not even see all the names, and Yolanda. And one of the things that is so unique about the way we have chosen to focus on that care focus area and how we bridge transitions is we work with partners, and we have certain roles that work inside of our hospital and inside of our facilities, and they are literally that bridge for individuals. And so I just want to open it up if Eric or Grace or Yolanda want to share even just a little brief story on what have you all have seen this directly through the eyes of our patients. What have you seen made possible? They didn't know I was going to call on them. So.
It's
Or
okay.
Katie.
So this is Eric, and yeah, really wonderful opening, and love the idea, the ideas that I've heard so far. What has happened? What are we making happening? You know, culture change has really been our focus, our ability to come into Peace Health St. Joseph's, really Peace Health Northwest, and help to change the dynamic, change the culture around how we provide care, team-oriented care for certain populations, such as the substance using population. And what does it mean to then, you know, take that care that was, you know, at one point looked at as something we would look to try to work on at discharge? What would that look like to put that at the forefront of the care so that we can integrate it with the discharging plan and work on it through the entire stay for that individual? And so as a result, what we've seen is individuals reconnecting with many community services. Many of you all here have provided those services. An actual discharge plan where folks are feeling like they're not leaving the hospital without tools. We are constantly blessed with stories from our patients who have, you know, ended up here in the hospital for this or that reason, nonetheless have found themselves in an area of support and have built relationships with multiple agencies. And it is our strong opinion that the beneficiaries are not just the patients. It turns out it is also the community and care teams involved, right? So diminishing some of the barriers and making this more of a fluid objective overall for enhancing wraparound services and so on. So that's really what I wanted to leave with you today. We have a number of programs that we're very excited about that are new developments coming up here. I don't want to take a whole lot of time, but we are reaching a milestone here, Rachel, that I think you are aware of, which is Cascade Medical Advantage has been blessed to be here at the hospital now for about 3.5 years. We are just about 35 individuals outside of seeing 1,000 individuals bedside, and helping over 70% of that population reintegrate with services of their choice. And so we kind of changed the dynamic, right? It's not you need to do this, it's how can we help you? We're happy to do so. And so again, with the culture change, our community partners that go far beyond my knowledge, and the overall effort, we're seeing a great deal of wellness come to our community. So thank you very much.
Awesome. Thank you, Eric, and thank you to all of you that are on the community connector team that we don't have a name for it. It's so impressive and remarkable. And many of these organizations I just mentioned have found a way to fund these positions because they see the invaluable, just like how much impact it has in our community. Great. Grace said she loves doing this work. We miss you, Grace. Just some great little comments in the chat window if you had a chance to take a look. Jessica joined in from East Wacom Regional Resource Center, and that is a partnership where it's quite a drive. If you've been out to Kendall from Bellingham, it's about 45 minutes. And what we know is that our community members that live in the Lower Cascade Valley are driving 50 miles round trip to receive specialty care, or even in some cases to meet with their primary care physician. 50 miles round trip to access care. And so that outreach work, and that whether it's food access, whether it's outreach for care, that's a huge burden on those families, and one that we hope to build a different trusting relationship with. So thank you, Jessica, for sharing. Did anyone else want to share? as we start to wrap up this segment. Bill from the YMCA.
Yeah, thank you. So I'm Bill Zills from the YMCA, and I just want to highlight a very cool partnership and collaboration that occurred with us last year. Our original partnership with Peace Health has been around the ACT program, which is a program that's focused on obese youth, and they're actually it's not a weight loss program per se, but more of a how to teach the families and youth healthy activities, healthy food preparation, and really make healthy lifestyle choices. And that's what our partnership has been. It's been fantastic. And then last year, March happened, and we couldn't do that safely in person. And so, first of all, Rachel reached out to me proactively and said, "Hey, this grant that we've given you, we know you can't do it well. It's now unrestricted," which was fantastic because we were able to take that. And one of the things that we've learned is that food insecurity is one of the main causes of health inequality and health equity issues. And so we were able to take that funding as well as a fleet of buses that we've typically transported children in, and we weren't able to do that safely, and we converted them and partnered with Wacom Community Foundation, the Food Bank, Peace Health, and we were able to start a food delivery where we picked up food at the food bank every week and delivered them to East County, North County, Birch Bay, and to date we've delivered boxes of food to families on a weekly basis. And we see that program now as an ongoing way that the YMCA can do its part to work with food inequality. And we just appreciate the partnership and the support and the collaborations in our whole community, because we couldn't do it alone, but we can play our part with everyone else. So thank you.
Thank you, Bill. Okay, I think someone was going to go next and share a little bit about vaccines, which is so timely. While we're here today, we have 27 patients in our critical care areas with COVID. Most, if not all, are unvaccinated. And so we need all of your help. This is still very present in our community. We need all of your help to get the word out. Who would like to go next? I think someone was going to go off mute.
Hey, Rachel, it's Erica.
Erica, jump in. There you go, segue.
Yes, I love hearing this conversation because it's a preview of what life will be like, hopefully for the health department as well after COVID. But I only have COVID examples right now, and there's lots of great examples of collaboration. But I do want to share how wonderful it's been for our community to have the partnership around vaccine. While you shared that really sad and disappointing statistic about the current census at Peace Health, we have a counter statistic, which is hopeful. And we reached over 100,000 people this week have initiated vaccine in our community. So we're getting there, and the health department couldn't do this alone. We can't thank Peace Health and our other partners enough. We stood up a clinic at Bellingham Technical College, and we have Peace Health as a partner. CMAR, Unity Care has been a huge partner with staffing and so much support. Family Care Network, Hoagland's Pharmacy, Bellingham Technical College, Whatcom Community College, and the Health Department. And it's a major source of support for our community for getting vaccinations. Our nursing students are having such a wonderful first experience in clinical practice by being able to be the vaccinators for our population. I think something they'll never forget in their careers. And we're getting there together, and it's been really nice to see so many providers and pharmacies and others saying, I see myself or my agency in the solution to this, and I want to step up. I want to change our operations so we can get people vaccinated. And Peace Health single-handedly, gosh, I don't even know how many people you folks have vaccinated, but I so appreciate you taking on the mass volumes, but also being laser focused on making sure that people who have barriers to or access issues or any other types of challenges that would make it hard for them to be vaccinated, that you're really laser focused on making sure that there's space for them, that there's opportunities for them to be vaccinated as well. So just really, it's nice to see this partnership as we are hopefully rounding the corner toward a return to better than normal. So thank you.
Laura, I'll go to you next.
Well, I'm Laura from Common Threads, for those of you who don't know me, and I'm just such a big believer that when doors close, windows open. And I feel like this year has been so much of that, and that there have been collaboration muscles that we've gotten to build in community. And I mean, I'm grateful that there are so many of you on this call, even that I've known and loved from afar for many years, and this crisis has brought us closer in ways that I believe will not be undone, and that will only grow stronger. And so whether it's collaborating with the food bank on projects like Farm to Freezer, or the Viviendo Bien project for the migrant farm workers, or whether it's supporting the school district with emergency food distribution and making sure that the school gardens that the kids aren't in, the food is still getting grown and put out into community. And Lindsay, I hope you're smiling at the rebirth of the Sterling Paws Garden. And Jessica, it's so much fun to work with you in the East County. And Rachel, a year ago you asked me if I wanted to do that integrative nutrition course, which at the time sounded so great, and then ended up being one more thing on a really full plate. But one of the things that really made me think about was just that nourishment is such a holistic concept, and I'm grateful to live and work among all of you who really are so open to the collaborations that help us get all this work done, and just for this moment of gratitude that you've brought us all to today.
Incredible. Thank you, Laura. Thank you so much. One of the things we love to do is actually get into the garden with Laura and her team. So even as busy as we are, we find that it just clears our minds and also gets us a chance to be together. So I know Lynette and Bev and I got to dig for potatoes at the end of the season last year. And that picture I showed you all of the bounty, that's what came out of the Wacom Middle School community garden. Could you ever imagine more beautiful vegetables? So we're going to transition, and I'm going to hand off to Patty Imhoff, one of our community collaboration members.
Hi, I'm Patty Imhoff, and I want to say thank you to all of our partners. It was so much fun spending the last couple of days bringing lunches to you and hearing your stories. And one of the things that came up out of last year for the committee was Barb mentioned earlier that along with collaboration, one of our main values as an organization is health justice. And one of the things we really realized when we were talking about our values as a committee and where we needed to head was that, and all the activity that was happening last year, was that systemic racism was not just somebody else's problem, it was our problem in this community too. And it was part of what we needed to do a better job of. And the unjust systems were leaving some people out and bringing privilege forward. Some of us on the Community Collaboration Committee, Barb Lupo and Lynette Jensen and myself, come to the committee representing our boards. And we really went to work. Those of us who come from board positions really went to work to educate ourselves, reading more books and talking more about the whole issue around racism. And kind of as a result, we brought that to the Community Collaboration Committee to right commitment to advance health justice to all, and how we could communicate that not just to ourselves, but also to our partners, and make sure our partners understood that we have such fabulous respect for the work you do around the issue of health justice and treating everybody in a cultural way that works for them, doing a better job with language and doing a better job with culture. And I heard that so much from many of you yesterday and the day before when we visited, that that's one of the things that really came out of the pandemic for you as organizations too, was doing a better job of respecting cultural food needs when you were gathering food and delivering food, and doing a better job with language. In addition, we brought Brittany Fuentes onto our committee, who's a public health nurse, but she also is kind of a specialist in the language needs and diverse populations. And one of our big takeaways is that we became more intentional about being aware. And one of our biggest shifts and changes were that instead of just bringing more voices to our table, we started going to other people's tables, going to your tables. We weren't able to do that so much this past year because of COVID, but we look forward to getting out and visiting you and doing a better job of listening and asking questions and supporting you, elevating the voices. It's real easy for us to say, well, we don't have a whole lot of diversity in our community. But when we start looking deeper and asking questions and getting out into the community instead of staying in our safe little boardrooms, we're recognizing and finding the diversity, and hope we are at the same time doing a better job of supporting and addressing that. So we really welcome your help in that area also. Barb, Lynette, do you have anything to add to our conversation around health justice and equity? I'll turn it back to you, Rachel.
Thanks, Patty. I think Patty's prompt is such an important one. You heard her say that we, first and foremost, our commitment is to listening. And I hope that we are truly walking the talk when we say that. When you see us come visit you or reach out to you or call you, that's because we really want to hear from you. You are the ones in the community knowing what the needs are and what the greatest needs are. Looking forward, we are about to head into our next assessment and planning period. So every 3 years, we do a community health needs assessment. And you are going to be the first among who we reach out to hear, where should we be most focused? Like, what are the needs that most need our attention, our time, as well as our investments of resources? And that is the guidance we're going to take to inform our next plan. So we will be beginning that work hopefully in the fall. And until then, we are going to be heavily engaged in the Healthy Wacom Community Health Improvement Planning process, which actually kicks off tomorrow. So I think some of you may be familiar with that or be a part of that. That work is very much framed around early childhood development, which was the #1 need we identified out of the last community health assessment cycle, was the well-being of our youngest children and their families. Truly, that's where we must begin. And those investments we make today are going to be the ones we will be celebrating 10 years from now. I have to, if any of you are on the Bellingham School District Facebook page, last night they posted a video, and it was celebrating that it has been 10 years since they made kindergarten accessible to all children for free 5 days a week. Did anyone see that little video? It was incredible. And what you may not know is that my 14-year-old daughter was the first kindergarten class to be able to go 5 days a week. And this year she's a freshman. And so I just want us to all think about that 10 years ago, we didn't even have access 5 days a week equitably across our community. Those kids are only in freshman and high school right now. So there's no better time that we can be acting on these things that we care about and reducing those disparities that we see. So as we wrap today, I just want to mention a couple of, I'm just blown away by how many of you came today. I'm humbled. And we didn't get to hear from all of the partnerships, but one in particular I want to, as we kind of close and begin, this week is in recognition of missing and murdered Indigenous women. I'm wearing red today. I see some of you that are also wearing red in recognition, actually a number of you wearing red. And our relationships with our Coast Salish peoples are the most treasured relationships that we have. And it is the learning and work we are doing through them that is so significant in the work we have before us. So I want to especially recognize Candace Wilson, who is here today from the Lactamish Foundation, and Barbara Juarez from the Northwest Washington Indian Health Board, and Melody for your partnership through the Northwest Regional Council. They have been, these three women in particular have been guides for us in how we build a different relationship. I'm very excited to share that Barbara and I and our community are working on a plan to create a Native liaison program so that our patients in this community can have that same experience that they have had with Yolanda and with Eric, but someone from within their community as they're making transitions. So excited to share that, and then of course more work on the horizon. I want to just pause there as we're almost out of time, but open it up if there's anyone else that would like to share as we close today.
Hey, Rachel, it's Elliot. If I might add something, for those of you that don't know me, my name's Elliot Quita, and I have the privilege to serve as the Chief Operating Officer here in the Northwest Network for Peace Health, and I've just about passed my 4-month mark here in the community and with Peace Health, and I've been thankful for the opportunity that I had. I've had the fortune in my healthcare career to work in some similar great organizations like Peace Health and in communities that also, like we're doing here, trying to really make the lives of the communities we serve better. But I just have to tell you that this is at the top of the list, and I've lived in 4 different communities across the United States, and this is as good as I've ever seen, if better than anything that I've seen before. And again, before I arrived here, I thought some of the places I had been were at the top of the list. So I just want to send my thanks to all of you and applaud the work that all of you are doing here in this community to take care